Smith talking to me earlier from the Nottinghamshire Healthcare Trust. In the studio now is Léonie Mathers, who was looking at the figures and pointing up these rise in cases of self-harm and suicide. As you heard Simon Smith say, it's a statistical game that we're playing here, because they're just treating more patients, they're spreading their duty of care into prisons, and thus it wouldn't be surprising that numbers would go up.
Well, I think they are seeing a lot more patients. There's a lot more people coming into the mental health services, and that's partly to do with the whole range of issues which are happening out in the community. But I think it's also important to note that some of the increase in people that they are seeing are sort of at the lower end of the scale, people who might not have had contact with mental health services before, who are now coming into contact. So I think we can still look at those people as those who are less likely to be self-harming than that at the more serious end. It's still an incredibly worrying figure as well when you think that's nearly 4,000 people who are self-harming or attempting suicide in the mental health system, and there's something going terribly, terribly wrong there. And it's just about having this conversation now and really focusing on what we can do.
What is it that you're trying to achieve here? I mean, in one sense it looks like you're trying to say that the local NHS Trust is not doing its job well enough. Is that what your argument is?
Do you know what? I don't think it's about the local NHS Trust at all. This is happening across the country. We're seeing increases in the number of people who are self-harming. We're seeing increases in people who are accessing mental health services right across the country. And what I'm really worried about with these figures is that we're sort of coming upon a bit of a perfect storm of crisis for the most vulnerable people in our society. I really want to have a conversation about mental health, because 1 in 4 adults at some point in their life will be affected by mental health issues, and what we're seeing at the moment is problems with benefits, which people are waiting a long time to get decisions and support. A lot of people are being put off benefits entirely, and at the same time the County Council, for example, have seen £154 million of cuts to make over the next 3 years, and that means organisations like Framework, which have been doing a fantastic job supporting people at an earlier level, are being cut. And nationally, our mental health services have seen £250 million of cuts as well. So
this is another area where an incoming Labour government would spend more money. People don't believe that you've got the money to spend, whichever party you are in government.
Well, I think part of this is about choices. It's about saying, where are we going to be spending our money, where are we not going to be spending our money? For example, you look at the current plans which are being consulted on about reorganisation of the Nottinghamshire Healthcare mental health services themselves. We're looking at closing, for example, 2 acute wards up at Queen's Medical Centre, and the risk of that is, I don't know if listeners will be aware, but the Priory, a private firm, are looking at setting up a mental health ward in Nottingham, and that's going to be something that the NHS is going to end up paying for. So our taxpayers' money will be paying for people to be going in a private firm, and that's all going out of our system. So it's not about the money not being there, it's about the choices and how we use that money.
Well, the word from the NHS Trust on that potential closure of the 2 wards and also in Newark is that the way that mental health services work is changing all the time, and more people are benefiting from being treated at home. So there's less and less need of an institutional solution. And maybe it would be a great benefit to the NHS if money were saved closing those wards, and then the extreme cases could be treated by a specialist such as the Priory. I mean, just having wards for people with mental conditions isn't a solution to the problem, is it?
Well, I think there's different things to look at, and you look across the range of changes that they're looking at making. For example, you've got Newark, which is a very underused service. We saw the wards at City Hospital earlier, which were underused, which are being closed, and I think you're right there. That's a good way of saving a bit of money, and treating people in their own homes is what people themselves have said that they want. But then you look at, for example, the QMC wards, and actually we're still seeing big pressures on beds, and it's really, that's not in the same category. We're talking about those beds are still very well used. It's a good aspiration to be treating people out in the community, but there are going to be some people who need to be in hospital, they need to be being treated, and they need to be being monitored, and they need that extra support.
Thank you very much indeed, Léonie Mathers, who is parliamentary candidate for the Sherwood constituency for the Labour Party. It's 27 minutes past 5, and so the idea is...